Tony Guerra, very special person in my life. He is our veteran podcaster on the Pharmacy Podcast Network. And he always says, returning to the mothership, or calling us the Mothership Podcast. And Tony, it is just wonderful to be with you right now and talking with you. And we don't catch up enough. So welcome to the mothership.
I appreciate it. I always think of you as the Ravens head coach, because all the Ravens assistants go on to coach at other teams, and you just are developed podcasters, and some stay and some go. But I don't know. I've just not ever been able to leave the nest.
That's awesome. You don't actually even need the nest anymore. You've done some amazing things with your own podcast focusing on residency, the pharmacy residency podcast. And boy, residency is changing. And that's kind of what I wanted to get in with you today. I really wanted to dig in the state of the nation of residency, the state of the nation of our pharmacy industry, the fact that the reason why we haven't had enough content around that topic is because health system pharmacy is where we have the least amount of content in comparison to our sweet spots, which are community pharmacy and specialty pharmacy, and even talking around technology. But residency, to me, has always been kind of a question mark because of how it's changing, and also how other sectors of pharmacy are digging deeper into the resident process in order to assure that it's the right place, the right career path for the pharmacist. Pharma, MSL, even artificial intelligent residencies for pharmacists is exploding. So I want to give you the floor and just give our listeners updates on the state of the nation of pharmacy residency.
Well, unfortunately, the data to actually tell us what happened will not be out till March on match day. But I can tell you what happened last year and what we might see this year. So what was kind of surprising about last year is that the number of people applying for residency went down by about 900. And that caused a tremendous increase in the percentage of applicants that were accepted. So after you got the interview, acceptance rate was about 67% 2 years ago. And then last year was almost 77%. So you're almost 4 out of 5. And I know that you had sent me the notes where they'd really tried to target 2020 as enough residency placements for everyone that wants one. But it's reasonable that that's going to actually happen by 2025. And I'll try to take you through the journey here. So each of the next, including this year, each of these 3 years, we're going to lose about 500 pharmacy graduates. So this year, next year, and the year after that. But then the year after that, it's closer to 2,000 because of the enrollment. So interest in residency has gone down. We don't know why necessarily. We know that fewer are participating in the workforce, but we don't know if it was, maybe that was a blip or maybe that's a trend, and we won't know that till March. But right now, many in community have felt that they were stuck. I think you also mentioned as well. And the chances have never been better to move from community to a residency to a hospital position if somebody wants it. So it's just a really exciting time as things just get turned upside down in pharmacy. And it really is, if you want a residency, there's a reasonable chance that you're going to be able to get one.
You know, I think of the so-called match process and how it seems to be controlled and dictated around mid-year and around the ASHP, and it makes sense, the leading organization for health system pharmacy. However, with the online world expanding, virtual expanding, how the pandemic taught us that that we can get a lot done via the Zoom call per se, or virtual call. Do you see technology starting to implement some changes to the residency process and pulling it out of just being controlled by the standard, which is obviously ASHP, and nothing against ASHP at all, I'm just thinking of the world of moving a little faster and also getting results back quicker than kind of the anticipation that's created around the status quo.
Yeah, no, you've actually hit the nail on the head, which is that especially the leading residencies, those that, let's call them the Harvards of the residencies, or you're in Pennsylvania, so the Pitts and Penn States of residency, right? Or it would be Wharton, the Wharton School over at Penn. But what's happening is that because of the pandemic and everything went virtual, the site said, well, why don't we just do our own? And that way it'll be smaller, the chaos won't be there, we'll actually get to know applicants quite a bit. And what happened was that once we went in person, that never stopped. So some programs didn't go, although my understanding is that ASHP had more programs than they've ever had. That is possibly because of growth, possibly because they're concerned they're not going to get residents with the number going down. But the thing is that now, more than ever, you will have, besides ASHP, you will have an opportunity to actually talk to the program in some way or another in one of those smaller groups. And that's because of the technology. Now, the big thing on the Reddit boards and social media is many of the applicants are rejecting programs that are requiring in person. And that's mostly for those that would be out of state. So if you say we are doing in person only, you are basically locking in a very regional group. And maybe people will fly there, but my daughters and I just went to Arizona to visit my parents, and it was almost 300 or 400 a person to get there. And I've got 3 kids. So, it's just, to go to 12 residency sites is just unreasonable. So I think you're going to see a contraction where it's going to be very, very regional, even more so than it was before.
Dr. Glaucoma Flecken, one of my most
Yeah,
favorite
yeah.
social media guys. He did an amazing, uh, uh, take on residency and how basically making fun of the system and how expensive it is for our pharmacists and our physicians and our nurse practitioners that are spending hundreds of thousands of dollars to get themselves to where they are, and now they have to spend an additional X number of plane tickets and processes to get to the where the interview takes place. And so bravo on your insight. You've been talking about this for quite some time. Where do we merge the world of, we're on StreamYard right now,
Yeah.
Zoom, Riverside FM, all of these platforms that are becoming excellent in producing interaction to the point that it's now CMS reimbursable to be on a platform with your physician and or your pharmacist and getting care, and now they're reimbursing for that. So if it's good enough for our patient slash pharmacist slash physician environment, why is this not the way to go in the world of residency and interviewing?
Well, eventually, I think, and this is way down the road, but eventually the resident wouldn't actually have to move there. Many residents worked virtually. The charts were sent to them via secure email or secure whatever. They had the software at home. They did what they needed to do with the patient, and that was taken care of. So I think that the promise of pharmacy, let's go back to what the promise of pharmacy was, 80s, 90s, whatever, is that you're going to have a steady job that's going to allow you to be with your family, that's going to provide that flexibility so you can go part-time, still have a decent income, and have a great quality of life. And I have that now, but not with a traditional pharmacy role in teaching at a community college. But people are saying it's much less important for me to go into whatever role as it is that I want to spend time with my kids on the weekend and coaching them and being able to take them to their activities and those types of things. So I think where everything meets, and you've always been the technology leader, because I think if we go way back to when you started the pharmacy podcast, and even before that, you were a tech guy, if you want to call it that. And I think what's going to happen is the technology will allow pharmacy to come back to its promise, and its promise of providing a flexible position that is respected and that also has a decent salary attached to it so you can support your family. I think that's what the technology needs to do. And I think we need to get away from this, oh, I'm going to be at a hospital for 80 hours a week, instead saying, okay, well, what of those activities do I actually need to go to the hospital for?
Mm.
Yes, maybe I'll do rounds, but what could I have done from home? What could I do remotely? And what can I do remotely? I think during the pandemic, you were one of the groups that was helping with APPEs, making sure those were remote and the students could graduate. So I think that the next kind of piece is, how do we make pharmacy family friendly, for lack of a better word, or work-life balance friendly, things like that.
That's true. And being able to take advantage of the technology to then um, backfill some of the needs for specialists.
Yep.
Someone who specializes in titration from one jack inhibitor to the next, and saying, who's the expert in this? Oh, there's some guy over in in San Diego, California, that's a specialist. And then you
Oh
start
yeah.
engaging. I think that is part of the future of pharmacy, the part of the future of accessing through data. What I want to know is, where is the process, the process czars, right?
Yeah.
Are there control mechanisms that they're afraid of change, that they're not going to allow this to take place? And if that were the case, which I know it is, um, where where do we comfort those control points of saying, hey, we can loosen this because of the way that virtual is changing medicine, virtual interactions changing medicine. So therefore, the process of residency and the process of data gathering and sharing and collaboration, that can also change with what we believe in as the process of pharmacy residency.
Well, let's start with the issue that we had maybe 5 years ago, was that a residency was, this very difficult thing to get. It was, you mentioned in your email, the supply demand issue, that the supply of people that wanted the residency is much higher than the number that are available. But now that's going to cross, and I know you're old enough to know the Ghostbusters never crossed the streams. But what's going to happen is the number of students applying for residency will be lower than the number of residency spots available, or higher than lower than the number of residency spots available. I predict within 3 years, because that'll be when that huge drop comes. So barring a catastrophic economic condition where students are not getting jobs right out of school, where they have to go to residency, that's going to happen. It already happened in PGY2. So just a reminder, the PGY1 is that general residency, and the PGY2 is more specialized. When the match was over, there were more spots for PGY2 than there were people that were still available. So there were more spots available than people that were trying to get them. And so that's going to happen to PGY1 in a couple of years here, if the trend continues. So kind of back to your question about the technology and how all this is going to come together. And your show, the Pharmacy Podcast Network, has done a great job of technology all across the board. I think it comes back down to what is it that we can do to increase the number of people that are going to be interested in pharmacy, because we're looking at about, I think, another 7% drop this year in the number of applicants to pharmacy school. And that is continuing to happen because they're hearing from their parents who are working, and they're hearing from the technicians, and the technicians are working, that the conditions are very difficult. And that the flexibility and that promise of having the job where they're caring for people, having time to work with the people, is not there. And when you reverse that trend, then I think the trend of students coming in will reverse. But back to the residency thing, I think that we do need those specialists, but I'm excited that there will be a spot for everyone very soon.
One of my favorite blogs that gives me some clarity and insight to so many different topics. If you're not reading TLDR Pharmacy in your
Oh, yeah.
environment, then shame on you. But what an amazing blog. And I did have a portion in there where, the TLDR, he points out 143 accredited schools. The number of full-time enrollments has increased on average by 2.7% annual since 1990, but growth appears to be leveling off in recent years. And then your updated information with what's going to be happening over the next 5 years kind of even changes that even a little bit more into focus. So the data acquired from that match statistic process shows us what's happening up into and past a little bit by the pandemic. But some of the demographics that you just shared with us, Tony, I think starts to show a little bit different picture in the future of residency for pharmacists.
Yeah, for
What
sure.
do you think's going to be happening? And I know that you don't have a crystal ball, but you've really tracked this, in my opinion, more than anyone, based on your constant clarification and documentation through audio, through the pharmacy residency podcast. So, what do you think's going to take place now, 2 years into the future?
Uh, well, it's going to happen this year, I think, too. But I think that you're going to see that residencies are going to turn things around. It's going to be turned upside down on its head. Where maybe a couple of years ago there was we use this word entitlement for a very different reason, but there was very much maybe an elitism that we're a residency, we'll let you know if you're good enough. But all of a sudden, they're hearing that many residencies last year didn't match. The number that didn't match, and this is the residencies, not the resident or the applicants, doubled last year. And that could go up again. And as the number of residencies go up and as the residencies start not matching, that's one place where they're gonna be like, whoa, I'm not gonna have a ticket to the ball. I'm not going to have a resident. The other thing is that I don't want to use the word quality, the choice residencies has gone way down. So if you look at the data on the ASHP match stats, the average residency got around their third choice. That's not right, a 3.0 ratio. And so the way that ratio works is if you have 8 residents, you went down to your 24th pick on average. So somewhere in that residency class of 8, they are the 24th choice. Where on the resident side, it's the opposite. 90% are going to get first, second, or third choice. So the match it's widening, and the residencies are going to have to become more attractive. Whether it sounds like you're going to a beauty parlor, but they need to be more attractive. What makes a residency more attractive is better quality of life, better pay, better working conditions, better teaching certificates, research, all those things. And so ultimately, it's a really good thing that's going to happen is that the residencies will actually level up as they're looking to get better and better students. So it's a great thing happening. But tell me a little bit more about some of the residencies that you talked about that were kind of out of the way. We have the hospital residency, the community residency, managed care to some extent, not always ASHP accredited. But tell me about maybe some of the interesting residency aspects that you've heard of, especially with technology, because I was just like, whoa, that's cool. AI during residency, that just seemed really neat.
Yeah, so MIT has had a professional development residency in their technology and coding department that included artificial intelligence. And within that artificial intelligence, they actually had a participant that was a PharmD slash MBA. So having that kind of pullback of understanding medication management and the evolution of artificial intelligence, as well as the current events around voice activation and in combining with AI, as well as the run amok chat bots that are now involved with medical driven accessibility of content and libraries and things like Medispan, and quickly accelerating decision trees based on what a physician or a pharmacist decides to do. So there is no question in my mind over the next few years that PharmDs that are technology. I mean, every PharmD is a little bit of a nerd, but then you heighten the level of nerd, and nerd level 10
Computer
is
nerd.
a coding, pharmacist that loves code, that is also into AI. And so I see the development of artificial intelligence and what that means for medication management, as well as schools out there who invest in professional development, like MIT, for example. Investing in medical grade residencies that are around artificial intelligence, and that's just one that I know that is out there and living and breathing. Community pharmacy, the CPSN network, is all about community pharmacy residency now. And I've even seen one-offs where state associations are embracing the community pharmacy residency program, as well as specifics under that umbrella that include disease state management, that start to concentrate on, you're doing a residency in community pharmacy, but we want you to focus just on diabetes management. And then all of a sudden they get involved with digital therapeutics and instrumentation and tools like Dexcom and our Omnipods and other things like that. So that excites me too, because it gives a research element and a research component to community pharmacy residency. And I think it starts to pack it with a lot more interesting variables of being a pharmacist, and attaching that back to patient care to make it sexier. Because every time you say the word residency in pharmacy, they immediately think of the hospital system environment,
Yeah.
because it was the traditional environment. And that's just not the case today. We're seeing residencies bloom out of other sectors of healthcare and pharmacy.
Well, let's talk about actually what might happen on the flip side. So I've said how it might get easier to get a residency, the number applying for residency might go down, and that residencies are going to be entertaining, wining, and dining the future hopeful residents, and that's going to work out. Let me give you another possibility, which is so some schools have made some significant strides in terms of making pharmacy school affordable. And my belief is right now that with inflation as it is, with the kind of, I want to say, there's certainly a group of non-traditional students that are a bit older that have little interest in spending another year in school, or maybe their spouse has little interest in them spending another year in residency or something like that. And I know University of Illinois Chicago, I believe Idaho State, and then there's one in South Carolina also, will allow you to go to school there for in-state tuition, no longer charging that extra out-of-state fee, reducing tuition by about 60 or 70,000 over those 4 years. And then the University of Utah actually provides free tuition to all students now coming into this next PharmD class. So if pharmacy school becomes more affordable, if students have a much lower debt load, I think that we might see quite a few more students applying to residency. But if you've got a spouse, especially if you've got kids and all of that, and you've got to explain to your family member how you're going to move to another state to make a third or a half of what you could have made after they've patiently waited 4 years for you to graduate, that's a tough sell. That's a really tough sell. So it might go the other way, where pharmacy school does become much more affordable as these next years come.
I think that it brings into thought and being able to see different opportunities of the future, is how many places do we put a PharmD who um, wants to be ultra focused to a specific care track or treatment track: the pediatrician pharmacist,
Mhm.
the cancer specialist pharmacist, the maybe a specific cancer pharmacist, endometrial cancer, for example, just focused just on that disease state. therein lies tracks of residency in the future if you really want to dig down into the specialties that open up opportunities that could be research driven and not necessarily premise, and that you have to literally be at that location. Like we started out in talking at the very beginning of the interview, that virtual has opened the doorway for so many other opportunities for our 300 and 500,000 active pharmacists in the country, and how those positions will be gobbled up by other they call it non-traditional pharmacists, and I don't like that term because
Yeah.
every pharmacist today is transforming into what they're deeming non-traditional. So I I find residency just as attacked in its status quo version as the rest of our entire industry, right down to how Kyle McCormick, Dr. McCormick doesn't even take insurance anymore at Blueberry Pharmacy, and he's telling the PBM to go pound salt. So everything is changing.
Yeah, that's the blessing of being a veterinarian for those that have pets, where it's just cash, and it's just makes it so much easier. But I did want to mention the letter of intent, which is part of the
Yeah.
residency process, and this is something I do with a lot of students, and I think it's misunderstood. So in a traditional cover letter, when you're trying to write to an employer and say, hey, this is why I think that we're a good fit, and kind of put your own thing there past the CV. Much like somebody might say, hey, I'd like to be on the podcast, and they kind of give you a little bit of a letter. The letter of intent with residency is very different. And there's kind of two things that happen. Either somebody just finds a letter of intent, fills in the blocks. I wanted to express my deep interest in blank, and I met the residents blank at ASHP, and so on. And it's a very generic letter. But another smaller group takes that time to really reflect on the last 3 years and how that program can get them to where they want to go. And those are the people that I work with at residency.teachable.com. And what we're able to do is, there's 4,000 residencies and you only get 12 shots. So it's like being at the carnival or the fair. You only get 3 darts, right, to shoot at the balloon, and there's 100 balloons out there, and whichever one you pop, you get that prize or whatever. And you only get 12 shots. And I think that being mindful about that letter and reflecting on it is what allows you to figure it out, and to write the letter over and over again, to make mistakes. I know that when I started podcasting, my first podcast was a little segment with Aaron, and then I think it was Pharmacy Future Leaders, then Pharmacy Leaders Podcast, and Pharmacy Residency Podcast. And just as the Pharmacy Podcast Network has grown and transformed, I've had my own little transformation within the podcast and who I serve. I think that it's important to figure out where you are, where you want to be. And the toughest thing, though, is to not be where your professors want you to be, to kind of say, okay, what's my niche? Because every one of your podcasters has a niche. It's just that's their chunk of the world. So how do you develop? I always take over the podcast. How do you develop individual podcasters? Because you have done this with it. It's going to get close to 100 soon, but certainly dozens of podcasters. How do you help someone develop their own, and I hate this word, brand, but how do you help them develop their own voice, maybe within the podcast? Because you as a mentor were just so instrumental in allowing me to start with students, to talk to them, then to talk to the leaders, and then to say, the one thing that I really, really think is misunderstood is residency. I like writing. You hate writing. Let's come together, and I can help you do your writing, because that's the one little place I wanted to help people, whether it's CV or letter of intent. How have you been that kind of nurturing grand poobah podcaster that helps so many people in their defined space?
Yeah, it's my rule is to stop trying to be someone else and just do your own thing. shout out to Dr. Jamie Wilkie, who
Oh yeah.
beat that up. She's like, quit trying to be someone else. Be yourself. Find your niche in a niche in a niche, and hammer it home, because you, as an individual, have very specific ideas about a residency, about a sector of pharmacy, about drug development, residency in clinical trials. There is no such thing. Why not? Why aren't we developing a good clinical trial management executives and people that lead the sensitivity around clinical trials? Why isn't that a residency? And it will be in the future, I'm sure, because there's going to be other accelerated paths of drug development that are going to need that kind of focus. But to back to your question, I only like to guide people by removing obstacles. I do not like to guide people by telling them where to go. I don't tell my podcasters where to go. I say, here's the obstacle. Stop worrying about the way your voice sounds. We'll make sure your microphone, gets improved, or, stop overthinking the show notes. Please don't give me 8 pages of show notes, because, we can't, we can't take them. So it's all about removing the obstacles of what I've banged my head against the podcast tree, and trying to say to that individual, here's how the network can remove the obstacle of accelerating your listeners, because we're going to get you to thousands of listeners in the time that it would have taken you 5 years or 10 years to get to that same level. That's one power of the network. And another is, like you said, building their voice, but echoing their voice. So I'm an amplifier. If someone told me you need an elevator statement, and I said I have one word: amplify. That's what I do. I amplify. I amplify the voice of pharmacy, and I do it better than anyone, because I know how to do it, because I've had to do it in order to make money. I had to leave my 150 plus bonuses realm. My wife reminds me often of what I left in order to become a permanent full-time podcasting publishing entity. And in order to do that, I had to have enough revenue and enough worth to my client, to my customer, to my listener, to my podcasters, to my hosts, in order to make it work and level up. And we're going in so many directions now with continuing education and supplementing journal articles, and the poster, walking up to a poster and scanning the QR code and listening to the authors, 11 or 10-minute idea of why they have invested this time in this poster and where that's going. I mean, all of these things came from the very first TE podcast in the world, for pharmacists, dedicated to pharmacists, came from the PPN, because I said, why isn't continuing education in a podcast? And someone's like, no, that won't work. And I'm like, well, why won't it work? So I grab my Rubik's Cube and I start twisting and twisting and twisting. And you don't have to necessarily solve it all, but you definitely have to come up with enough so that you can get the subject matter expert to come in and backfill. And that's what we're doing. So it's podcasting is just in its beginning. We know that there are 161 million listeners just in the United States. And these are people that keep coming back. The world of pharmacy is changing. So therefore, my publication, our publication, has to follow suit. And I'm excited what we're going to be doing in 2023. And the new show coming out called This Week in Pharmacy, which you're going to have to be a guest on that. It's gonna merge the consumer listener with the my sweet spot, which is the B2B pharmacist to
Okay.
pharmacist listener. And it's going to demystify pharmacy a little bit, but it's also going to be I've been waiting for a public relations company to come along and say, the only thing we do is public relations for pharmacists. And I'm like, well, I'm tired of waiting for that to happen. So I'm gonna do it myself.
Well, they need you, that's for sure, or the schools do. So, yeah.
Oh, this is a school I just visited. Just visited Yukon School of
Okay.
Pharmacy. A shout out to Dr. Rick Crow, and their team there is a the reason why I went up there is my godson Jelani is one of their defensive linemen, and he's been doing an amazing job, and I got to meet their team. I got to go to the football banquet. I got to meet up the one and only Coach Jim Mora from Huskies, and then I got to meet with a pharmacy school. So I was elated for that weekend. It was one of my favorite weekends in the closing of 2022, and now it's time to involve pharmacy schools in supplemental education information that comes from their cohort. So I'm taking the P2, the P3, and the P4s, and I'm gonna start picking pharmacy schools to develop content for their fellow classes and helping to accelerate understanding and sharing and sandboxing. And so we'll see what happens. But we have 10 pharmacy schools kind of on our target, and we'll see what happens in 2023 and if something can come from that. But I'm still looking for a host for Pharmacy Future Leaders. We need to resurrect I know I'm not going to get you to come back, but you were the best host ever for that podcast. But
I,
we need a
I
host.
love doing it. I loved having the students on there. So maybe we'll see about 2023. We'll see what happens. So
Yeah, you have so much going on. I want to share with the listeners an update for your personal world, your amazing triplets and soccer stars, and one of your
yeah.
daughters is now a marathon runner, winning her father's heart,
Oh,
and
5K runner, but yes, she is. So she
that's
didn't make a whole marathon. So
It's incredible though.
yeah,
That
yeah.
you put that as part of their life, that part of their life is the physical side, and the spirit of competition is so evident in your world, and it's very healthy competition. I don't see your daughters yet becoming out of control competitors yet, I guess.
Not yet, not yet.
Not yet.
But no, and kind of to kind of wrap this all up, uh, I was able to enjoy that community career in the beginning that kind of set me up to take the lower pay for a while as I went to a job that would take years to build up to the pharmacist salary, which I eventually got to. But it fulfilled its promise to me because I was able to be their coach. I am there nights and weekends to see them, to drop them off. But I'm also a good partner to my wife in terms of sharing the load. And I think that that's a really tough thing. Um, the number of weeks you leave in the year is the number of days I leave in the year. So it's amazing how how important the support is there, and then to kind of give back to the family. So again, I think that in the right situation with the right leaders, you can have that great balance between your pharmacy career and your family life. But I think that it has to come from the development that you provide, which is allowing someone to find that niche like Jamie Wilkie did. And man, she's got the 4 boys, right? And then so does Tim Ulbrich. He's got 4 boys as well, and other people with many children that really need that kind of flexibility. So I don't know. I think we can get it back. I think we can get it back.
And even developing supportive entrepreneurial ventures with your spouse that has nothing to do with pharmacy. I have to give a shout out to the very first virtual conference in pharmacy ever was by Dr. Blair Thielemeyer, and
Yeah.
her amazing rush into the market that was needed so badly when she started. Everybody thought she was nuts, and then all of a sudden the pandemic hit, and she had been 4 years into it, and then everybody's like, wow, Dr. Thielemeyer really knew what was going on, and she was a visionary, and now she's supporting a family owned business in the world of harvesting eggs and having a chicken farm. And
Yeah, I saw that.
she's a champion. Like I just
Yeah.
like that's a reinvention of their family and of their aspirations, but then being able to share everything and kind of tie it back to healthier living. And I think that's a testimony of not giving up and continuing to work.
Awesome.
Well, I thank you. We have to have you back more often than once every 3 or 4 years, and, and being able to get your mind share about the what is pharmacy and what's happening in pharmacy and how residency plays a part in this. So if something takes place over the next 2 years, that we can go back to this recording and say, see,
Told
Dr.
you.
Garrett Told you so.
Yeah.
Told you so. But I appreciate you and your support of not only the network but of our industry, and your heart is in this, and in it coming from someone that really believes in the evolution of our pharmacists. That means a lot to me because I am your hero. I mean, you are my hero, and I am your fan, and as I am pharmacists that are out there. So if you're listening and you want to get in touch with Dr. Tony Guerra, what's the best email to send you a message to?
TonyThePharmacist@gmail.com.
That'll be in the show notes. Thank you. We thank you so much for listening and everything that you're doing. And with that, we'll see you next time.
Yep.